Modern life is full of stress and worries. The competitive world has given us a challenging life, and many a times we cannot cope up with a fast-paced life, which leads to physical, mental and emotional disorders, which shatter us completely. In the modern world, mental health disorders have become a leading cause of disability globally, exacerbating human health. With the divine blessings of Lord Dhanvantriji, hope lies in Ayurveda. Dr. Navdeep Sharma, a spiritual healer from the city of the Golden Temple. His graduation from Sri Lakshmi Narayan Ayurvedic College, one of the oldest institute in our country, associate with Sri Durgyana Education Foundation. His masters from the University of Madras. His PhD in the role of Ayurvedic herbs in psychological disorders. Listed in the World Book of Records for promoting Ayurveda and developing a chain of Ayurvedic treatment and Panch Karma centers in various parts of the globe.
डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया। लंदन में इंडो यूके लीडरशिप समिट में द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने दिया उत्कृष्ट पुरस्कार।
लंदन में इंडो यूके लीडरशिप समिट का आयोजन, आयुर्वेद को लेकर जागरूकता पर जोर, द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने लोगों को किया सम्मानित।
Commendable Global Recognition Award was received by Dr. Navdeep Sharma and Dr. Monica Sharma on behalf of ND Care Nirogam Private Limited for leading Ayurvedic services at the British Parliament, UK.
मिला Outstanding Contribution to Ayurvedic Health Service Puraskar.
Dr. Navdeep Sharma has also been awarded the title of Pranacharya by the Akhil Bharatiya Ayurveda Mahasammellan.
आयुर्वेदिक डॉक्टर नवदीप शर्मा को युवा प्राणाचार्य की उपाधि दी गई। भारतीय आयुर्वेद महासम्मेलन में सम्मानित किया गया। कार्यक्रम में मनोज तिवारी मौजूद रहे।
नवदीप शर्मा को विश्व के सबसे युवा प्राणाचार्य की उपाधि मिली है। अखिल भारतीय आयुर्वेद महासम्मेलन में मनोज तिवारी भी शामिल हुए।
Up next, most trusted Ayurveda based healthcare brand of
सदियों से ही हमारे यहाँ राजा महाराजा चांदी के बर्तनों में भोजन का सेवन करते थे अपनी इम्यूनिटी को बढ़ाने के लिए। तो आप सबके घरों में चांदी की पायल, बैंगल, पेंडेंट, कोई भी आभूषण हो, जिस पात्र में आप पानी स्टोर करते हैं उसमें वो डाल दीजिए। उस पानी का सेवन करने से आपकी इम्यूनिटी जो है वो बेटर रहेगी। शुंठी, मरीच, पिपली, ये तीन हर्ब जो किचन की शोभा बढ़ाती हैं, इनका इस्तेमाल अधिक कीजिए और भस्त्रिका क्रिया अधिक से अधिक कीजिए। तीन चीजों का इस्तेमाल करने से आप हृष्ट पुष्ट रह सकेंगे और कोरोना नामक महामारी को दूर भगा सकेंगे।
Person who is a doctor in Ayurveda, he is designated to work as a surgeon. The person first has done a course of 4.5 years of BMS, in which he is taught the allopathic pharmacology, the pathology, then surgery. These all are subjects in Ayurveda. An Ayurvedic doctor has to study both the things, the Ayurveda as well as the allopathic aspect, looking at the modern demands. Now after that is 1 year compulsory internship, where in colleges like Apollo, BHU, Udupi, Bangalore, there are so many surgical branches running so successfully. Again after this, the doctor who has done BMS, he is required to give a PG entrance test, which is really very tough with so limited seats. And once the doctors who are the best are selected across the country, they have to do a 3 years of PG program, where they are given practical training for all those kinds of surgical procedures which have been allowed to them. I would also like to tell and add that after this there is a 2 years of PhD program for them, which is done by many doctors, and also there is senior residentship, which is the same as allopathic system. So in no way there is any cut short for any Ayurvedic doctor having seen the surgery. And this is something which is really confusing for everyone.
लेकिन ऑटिज्म च इस तरह नहीं है, लेकिन बच्चा काफी हद तक नियर नॉर्मल हो जाता है अगर बच्चे का इलाज सही एज शुरू कर लिया जाए।
जी, आज अगर कीने की बात करते हैं,
देखिए ऑटिस्टिक बच्चों की जब हम बात करते हैं तो जो सबसे कॉमन चीज ऑटिस्टिक बच्चों में देखी जाती है,
Regular coverage in most newspapers around the globe for his exemplary work in the field of Ayurveda.
When I was younger, I was very sensitive. I could feel the pain that people endured. My father once told me, it's good that I can feel people's pain. It would be even better if I could transform one's pain into soothing relief. These words of my father nourished and nurtured the divinely planted seed in me to become a compassionate healer. And my journey with Ayurveda, the science of life, began.
Good evening, the concerned. Good evening, the concerned enlightened parents of autistic kids. I am psychologist Sakshi from NDCare, which is known to provide the best treatment for the autism around the globe. The current session is tailored for your enlightenment and knowledge. I believe that you have done enough researches, but being as a professional, I'll be guiding you some of the tips which you can do at your home. In this session, I'll be discussing about what is aggression, its symptoms. Mainly parents are confused about the hyperactivity and aggression. So I'll be discussing about what is hyperactivity and what is aggression. Symptoms of in this I'll also discuss about the factors contributing to aggression, how to manage it, and what are the strategies that we can use at our home. So what is aggression? Aggression in autism spectrum disorders refers to the challenging behavior that may involve physical outburst. Example, hitting, biting, kicking, verbal hostility, example, yelling, threatening, or other forms of disruptive actions. Aggression can vary in severity and frequency, and it can be directed towards others, objects, or even oneself. It is important to note that aggression is not a defining symptom characteristics. However, it can be a behavior manifestation in some individuals with autism spectrum disorder due to various factors such as sensory sensitivity, communication difficulties, and environmental stressors. So what is the difference between hyperactivity and aggression? The parents are confused about this. So hyperactivity refers to a condition characterized by excessive movements, restlessness, and difficulty in staying still or focusing for an extended period. It often involves behavior such as fidgeting, excessive talking, impulsively, acting without thinking, and being constantly seen to be on the go. On the other hand, aggression refers to a behavior that can result in both physical and psychological harm to yourself, others, or objects in the environment. In autism, aggression is of two types: explained aggression, and second one is unexplained aggression. In explained aggression in autism spectrum disorder refers to the understanding of why some individuals with autism exhibit aggressive behaviors such as hitting, biting, kicking, or verbal outburst. These behaviors are not part of the core features of autism but can arise due to difficulties in communication, emotional regulation, sensory sensitivities, and other challenges associated with the condition. Recognizing and explaining the causes of aggression in autism is crucial for managing these behaviors effectively. So what are the common symptoms of explained aggression in children with autism? First is physical aggression, such as hitting, biting, kicking. Physical aggression towards others, example parents, siblings, or peers, is one of the most noticeable symptoms. The child may strike out during moments of frustration or sensory overload. Next is throwing objects. When upset, a child with autism may throw objects around him, sometimes aiming at others as an expression of anger or frustration. Next is pushing or shoving. The child may push people away when they feel overwhelmed or distressed. Second is verbal outburst. Example for the children who are verbal. First is yelling or screaming. Verbal aggression may take the form of shouting or screaming during situations that provoke anxiety or frustration. The child might raise their voice in response to being overstimulated or unable to communicate their needs. Threatening language. In some cases, the child may use aggressive or hostile language, though this is more common in children with higher verbal skills. Third is self-injurious behavior, headbanging. It is one of the main symptoms that is being common. A child might hit their head against walls, floors, or objects, particularly when frustrated, anxious, or unable to communicate what they are feeling. Biting themselves. Some children may bite their hands, arms, or other parts of body during the episodes of distress. Scratching or hitting themselves. This can occur during the moments of emotional dysregulation or when the child is in pain and cannot express it verbally. Fourth is property destruction, breaking toys or objects. A child with autism might exhibit aggression by breaking toys, ripping books, or damaging household items during the moments of frustration or sensory overload. Knocking over furniture. In severe cases, the child may push over chairs, tables, or other furniture as a way to release their emotions when they are overwhelmed. Fifth one is escalating behaviors in response to specific triggers. Changes in routine. Children with autism often prefer predictability and structure. Aggression may surface when their routine is disrupted or when they are faced with transitions. Examples: moving from one activity to another without warning. Next is frustration due to communication challenges. If a child is non-verbal or has limited verbal skills, they may become aggressive when they are unable to communicate their needs such as hunger, thirst or pain. Overreaction to sensory stimuli. Children with autism may have heightened sensitivity to loud sounds, lights, sounds, textures or smells. When faced with sensory overload, the child may react aggressively or as a way to cope with the discomfort. Aggression linked to emotional dysregulation. Meltdown. During emotional meltdown, a child may become physically aggressive, hitting themselves or others. This usually occurs when the child is overwhelmed, anxious or frustrated. Rapid mood swings. Emotional dysregulation can cause a child to switch quickly between calm and aggressive behavior, especially if they are unable to manage their emotions effectively. Seventh is aggressive as an avoidance strategy. Refusing task. A child may become aggressive to avoid a task or activity they find difficult, undesirable or overwhelming. For example, they may hit or scream when asked to engage in an activity they do not want to participate in. Running away or aggressively fleeing. Some children may engage in elopement, that is running away, or become aggressive to escape a situation that makes them uncomfortable. Now I'll be discussing about unexplained aggression. Unexplained aggression in autism spectrum disorder refers to aggressive behavior for which no obvious or easily identifiable cause can be determined. Unlike explained aggression, where specific triggers such as communication difficulties, sensory overload, or emotional distress are recognized, unexplained aggression presents a more complex and confusing challenge for caregivers, educators, and clinicians. Unexplained aggression can have various underlying causes ranging from psychological, medical, and environmental factors. Here are some symptoms of explained aggression. First one is irritability or easily provoked. The person may become irritated or angry over minor or significant triggers. Second one is sudden outburst. Aggression may manifest in unexpected intense burst of anger or physical violence without clear reason or provocation. Third is verbal aggression. Frequent arguments, shouting or making hurtful, threatening remarks towards others without provocation. Fourth is physical aggression. Physical acts like hitting, biting, pushing, kicking or throwing objects may occur without clear justification. Fifth is restlessness or hyperactivity. The person may appear restless, pacing or fidgeting and unable to remain calm or relaxed. Sixth is mood swings. Rapid and extreme changes in mood, shifting from calm to angry or aggressive within a short time frame. Seventh is difficulty with communication. The person may have trouble expressing their emotions, leading to frustration and subsequent aggression. Eighth is withdrawal or isolation. Aggressive individuals may withdraw from social interactions or isolate themselves, potentially as a result of feeling misunderstood or overwhelmed. Ninth is physical signs of stress, tension, clenched fist or muscle stiffness, indicating that the individual is under stress that may contribute to aggressive behavior. Now I'll be discussing about the factors contributing to autism spectrum disorder. First is communication difficulty. Many individuals with autism spectrum disorder experience difficulty expressing their needs, feelings or frustrations, which can lead to aggressive behavior when they are unable to communicate effectively. Second is sensory overload. People with autism often have heightened sensitivity to sensory stimuli, example light, sound, texture. Overwhelming sensory input may trigger anxiety or frustration, resulting in aggression as a reaction to discomfort. Third is changes in routine. Individuals with autism spectrum disorder often rely on routines and predictability. Sudden changes or disruption in their environment or schedule can provoke stress or anxiety, which may lead to aggressive behavior. Fourth is emotional dysregulation. People with autism may struggle with regulating their emotions or responding to stress, making it harder to cope with frustration, disappointment, or confusion. This dysregulation can sometimes manifest as aggression. Fifth is medical issues. Underlying medical conditions like gastrointestinal problems, sleep disturbance, or pain can contribute to aggressive behavior if the person with autism is unable to communicate their discomfort. Now, how we can manage aggression in autism spectrum disorder? First is behavior intervention. Applied behavior analysis and other therapeutic interventions can identify triggers for aggression and teach alternative coping strategies. Second is communication support. Augmentative communication tools, example picture boards, communication devices, can reduce frustration by improving the individual ability to communicate. Third is environmental modification. Creating a more predictable and sensory-friendly environment can help reduce triggers that may lead to aggression. Fourth is medication. In some cases, medications may be used to manage co-occurring conditions like anxiety, ADHD, or mood disorders that could contribute to aggressive behavior. Fifth is positive reinforcement, positive behavior support. Use positive reinforcement such as praise or rewards to encourage appropriate behavior and reduce aggression. Behavior analysis. Work with a behavior analyst to understand the function of aggressive behavior. Use strategies like deep breathing, sensory breaks, or using a calm down corner to manage emotions. Use sensory tools, sensory integration techniques. Tools like weight and blankets, fidget toys, or a swing can help regulate sensory input and calm the individual. Calming activities. Incorporate activities like deep pressure massage, physical exercise, engaging in a preferred hobby to reduce stress and prevent aggressive episodes. Seventh is model and teach self-regulation. Social stories. Use social stories or role-playing to teach appropriate behavior during the difficult situations. These tools helps the individual visualize how to respond in various scenarios. Next is self-regulation strategies. Introduce techniques like counting to 10, taking deep breath, or using a calm down signal that the person can employ when they feel aggression rising. Now, managing a child aggressive behavior, it can be challenging, but there are effective strategies parents can use to address it. Here are some of the tips to keep in mind. First is stay calm. Responding with anger can escalate the situation. Take deep breath and maintain a composed demeanor. Second is identify triggers. Observe pattern to understand what situations or feelings lead to aggressive behavior. This can help you to anticipate and prevent future outbursts. Third is teach emotional awareness. Help your child identify their feelings and express them verbally. Use tools like feeling charts to facilitate this. Fourth is set clear boundaries. Establish rules about acceptable behavior. Make sure your child knows what is accepted and the consequences of aggressive actions. Fifth is use positive reinforcement. Acknowledge and reward good behavior. Praise your child when they handle frustration or anger appropriately. Sixth is model appropriate behavior. Demonstrate healthy ways to express feelings. Show how to resolve conflicts calmly and respectfully. Seventh is provide outlets for energy. Encourage physical activity, creative play, or other outlets that allow your child to express themselves and release pent-up energy. Eighth is practice problem solving. Teach your child strategies for resolving conflicts and managing frustration. Role-playing different scenarios can be effective. Ninth is be consistent. Consistency in your response helps your child to understand the consequences of their actions and reinforce expectations. 10th is foster a safe environment. Ensure your child feels secure and loved at home. A stable environment can help reduce anxiety and aggressive behavior. 11th is encourage social skills. Help your child develop friendship and social skills through group activities or play dates, which can provide them with opportunities to practice positive interactions. By applying these strategies with patience and consistency, parents can help their children to manage their emotions and behavior more effectively. Thank you everyone. It was indeed a great honor and privilege to share my candid views and perspective on an important concern like aggression in autistic children. Please do share your valuable experience and feedback to make our efforts fruitful in dealing with autism. Thank you.